Ms. Heyliger, you're recognized for your 7 minutes.
Thank you. Good afternoon to my colleagues. Good afternoon to the staff, testifiers, people of the territory. First, I would like to say that as we celebrated African Liberation Day, African Day today, I was very happy as we continue to deal with understanding the unity of Africa and the rationale and reasons why we even celebrate this day as it regards to their efforts to push back against colonialism and the apartheid situation. Now, the first set of questions I want to ask has to do with the $1.4 million that was spent on retrofitting these trailers. Have you guys done anything to potentially try to recoup any of these funds, or is it a dead case, completely lost to us?
Thank you, Senator. Chris Finch, Chair of the Territorial Board. The $1.4 million was spent on vendors who did what the hospital asked them to do, so there is nothing to recoup.
Okay, so the other states benefited from that. So, okay, thank you. One of the things that was discussed quite a bit here today has to do with accountability. And I wanted to know, with some of the equipment, have you guys done anything to find out if any of these equipments are regulatory compliant and can be utilized before purchases so that mistakes don't happen? Do we have policies in place now so that mistakes for purchasing the wrong equipment doesn't happen and then it's a loss to us?
Senator, this is Doug Cook, CEO of JFL Hospital. Thank you for the question. As part of our procurement process and part of our intake process for all medical equipment, once it's received within the organization, before it is allowed to be put into service or to be used with the patient, it has to be inspected by our biomedical team or other teams to ensure that it is functioning as designated and designed so that we can ensure that, as you stated, that it is operating correctly.
Okay,
Senator,
thank you.
May I buttress that with just a little more information? The board attorney for the territorial board has created standard contracts for supplies, for equipment, for services. In virtually every possible case, we require the vendor to use our contract rather than saying using their forms. And these are built-in requirements into our forms.
Okay, thank you for that additional information. As it relates to when it comes to some of the monies that were lost due to not following protocol, non-approval of contracts, et cetera, has the organization done a total assessment to see how much funds were lost so that we could see exactly how utilizing this policy that you guys have just created or implemented so that these things won't happen again? Have you done an assessment of the total loss?
No, Senator. Chris Finch again, Territorial Board Chair. If I understand the question, the answer would be no. In the month that we've had the audit, my focus at least, and I believe I speak for the whole board, has been, are we sure going forward we are not going to experience the same problems?
Well, I think for me as an individual that, with dealing with business, there has to be some kind of assessment as to what the mistakes were and put a dollar value to it. Because for us to say it happened, and I'm here listening to the responses of many of the questions that my colleagues asked, and I'm hearing things, nobody know who's going to be held accountable. How is somebody going to be held accountable? So what I'm hearing today is, I'm not sure if anybody's going to be held accountable. We don't know how much money we really lost, but since this happened prior, We're just only concerned about what we're going to do in the future. But I have learned, whether you're dealing with government or private business, you have to know exactly what your mistakes were so you don't repeat them. Not know that they exist, but you have to identify. And especially when it comes to a dollar value, I would think that's very important for you guys to follow up and know, well, hey, we lost 2, 3, 4. I think that's very important. And that's my thought process. When it came to the Inspector General's report, they had a concern in regards to the competitive bidding. And I know there were some questions along those lines. Could you give me a little bit more in depth as to how some of the policies would potentially curtail any issues that might have happened in the past, so I can better understand how this won't happen? I understand you keep telling us about the policies exist, but could you give me an example of how this will take place?
2 minutes.
Senator, I'll start at least. Chris Finch, Territorial Board Chair. For the larger procurements that come to the board level, particularly at the Finance Committee of the board, members are provided a bid file. The bid file shows the RFP that went out. It shows the advertisement for the RFP. It shows the obviously the scope of services that's in the RFP. It shows who responded to the bid, the prices, the members of the bid evaluation committee, their individual scoring of the bids that came in. In the cases where there was only one bidder, questions are asked about why, if that's at all known, or in cases where there's only one possible bidder, the hospitals are required to write a justification memo. And you know, in some of these cases, it may be that the equipment was, you know, borrowed from Acme, and Acme has a single, you know, certified service contract that covers the Virgin Islands, so we have to use that service provider. But whatever it is, when there is not an opportunity for competitive bid, they're asked to write a justification memo, and both hospitals are using some group purchasing arrangements that are being used by numerous hospitals in the States that also works on getting better pricing.
Well, thank you so much for that. I'm not sure if my time was called, but if it was, Mr. Chair, may I ask the final question?
30 seconds.
You have 30 seconds, and then you may wrap up.
Thank you so much. The last question I'll ask in my time frame has to do with competitive bidding and dealing with competitive grants. As you know, we are aware the hospital do get grants, but under the last infrastructure bill that was passed by Congress, can you share with me any type of strategies or plans that the hospital is going to be utilizing to attempt to go after any of those competitive grants in order to assist the hospital financially?
This is Doug Cook, CEO of JFL Hospital. I don't have a exact plan of going after specific or how we will go after. We are constantly evaluating all grants that are available or opportunities to apply for grants and selecting those that we feel that we can meet the challenges of and support to help the organization, but ultimately to help our patients in the Virgin Islands.
Okay. Thank you, Mr. Chair. And I just want to make one final note. I wanted to send out condolences as we battle here in this territory our own issues against gun violence. I wanted to send condolences out to those in Texas on the unfortunate loss and murder of those children and adults and educators in that state. Thank you so much, Mr. Chair.
You're welcome. We did have a minute. Francis Heyliger, you're recognized for your 3 minutes.
Thank you so much, Mr. Chair. I wanted to focus a little bit on one of the questions I had asked earlier in regards to possible recruitment of the 1.4 for retrofitting these trailers. And when I asked the question, you said it couldn't be recouped because it was monies for vendors. The reason it was more along the lines of knowing that these were utilized when the states needed them back for hurricane time, and they might have requested funding. Have you had any conversations with them as to the monies that we put in versus them potentially could have gotten funding so we could have been reimbursed those monies since they were utilizing them during their hurricane situation? That was more along the lines I wanted to get an answer from. Have you had any communications to see if something like that was even possible?
Thank you, Senator. Chris Finch, Territorial Board Chair. I'll be honest, I was not even aware of the issues of the operating room trailers until the audit came out. That all occurred before I joined the board. But to answer your question is no. They were borrowed from those states through an interstate agreement that Vitema is part of, and I mean it's an interesting question. If we got an empty trailer and we sent back an operating room trailer, wouldn't it be nice if they
exactly?
It's an interesting question, Senator.
How we could have had a conversation to potentially recoup some of that money. So I'm putting it out there so it's something that you guys can actually look at, because I would rather you make the effort than not make it at all. You understand what I'm saying?
Right. I understand. Thank you for that, Senator.
Okay. The other question I wanted to speak on had to do with the premium pay, the incentive pay for the essential workers that worked during the hurricane. And I know when it came directly to the hospitals, dealing with the nurses, et cetera, they were hands-on. What I want to know, earlier there was a discussion in regards to capping it as to who would receive those fundings, and I think it was passed. Could you refresh my memory as to what was the cap as to who would get funding if it passed? I think it was 73 or something like that thousand.
Yes, that is correct. The number that was being discussed was 70,000.
Okay, 70,000. And is that a number that was discussed with the hospital and you guys agreed to it, or was this coming down from the administration?
This is Doug Cook, CFO for JFL. That number was not a number that we agreed upon. That was a number that was given to us. Again, what we've done is submit.
Go ahead.
What we've done is submitted all of our employees that worked during the time frame that was asked for from March of 2020 to March of 2021.
And the reason why I asked that question is that I am a firm believer that when it came to those in the medical field, they did quite a bit extra. And those are the ones that had a lot to do with the hands-on dealing of COVID, especially with dealing with the patients that were critical. So I take note when I saw some of the different formulas that various states did. And that's why I wanted to know where this $70,000 came from. And is this something that if they're insisting on, is the hospital going to push back? Because I'll give you an example for like in one state, when it came to medical workers, they came up with a formula that anyone that made more than $85,000, they were not allowed to receive it if they did not have direct contact with COVID patients. They might have worked in the hospital, but if they didn't have direct contact with them. And if they made $175,000 or less and they had direct contact, they also got it. And that was just one of the state's formula. Each state did it differently. So I am here to advocate for those in that 70 medium, because when you are in there putting your life on the line, when this thing came out and a lot of people didn't know about it and we were just moving along, to now be told that your work is not valuable just because of 70,000, I don't think that's right. And I would encourage the hospitals to really fight on behalf of their employees to see if you could get that number even higher, because I don't think it's a fair situation. That's my personal thought process on it.
Senator, your time was called,
yes.
Senator,
oh, my
quite
time
some time ago.
Okay.
Yeah.
All righty. Thank you so much, Mr. Chair, for the additional round. And thank you to the hospitals. And I look forward to getting a more updated report because the people of the territory, specifically St. Croix, needs these services. Thank you.
Thank you very much, Senator Francis Heyliger. 5 minutes at this time.
Thank you so much, Mr. Chair. Good afternoon again to my colleagues, testifiers, staff, people of the territory. I've sat here and I've listened to quite a bit of the responses, and I'm going to be honest, I really feel for the children of this territory. I mean, between the drugs, the sexual predators, the bullying, and just trying to get quality education, these children seem like they're up a creek. I don't know what is happening here. And simple things like data, simple things like information, so that when you come to this body, that we would be able to know what we have to do to help you, to help them. A lot of that is lacking. I'm very concerned because, even listening to some of the testifiers, now, as an individual that have attended quite a bit of IEP meetings for years, not a single time, Mr. Som, not once in any documentation I've read that has been handed to me, that has been turned over to me, that any of the individuals in the room that I have ever spoken to had a conversation with me correlating marijuana use and IEP students. But when you sit here and tell the public and myself that this is a regular part of the discussion, I am telling you point blank, that is 100% false. That is not happening. So I don't know if you have to go back to the drawing board, because my colleague brought a correlation between the two, and it might have been easier for you to just say that this is happening. But I am telling you, as an individual that have gone to quite a bit of these meetings, not once has that discussion come up. So you need to go back to the drawing board with that.
If I may, Senator?
No, you may not. Thank you. As it relates to understanding a little bit more, how do you guys intend on bringing parents involved? I understand how you're going to market to them, to give them or let them know things are happening. But after the fact, how do you intend to make them a part of the resolution and the solution to help these children?
Good afternoon again. Victor Som III, Assistant Commissioner. Senator, before I get to your question, I must say that your previous statement...
Mr. Som, I specifically told you cannot utilize...
Senator, it is unfair for you to make that statement and not allow me the opportunity to respond.
If you would like to utilize your time to respond
Assistant
to that,
Commissioner, is the Senator's time?
But I made it very clear.
Hold the Senator time. Senator Francis Heyliger, let me handle this, please. Assistant Commissioner Soms is the Senator's time. She asks what questions she want to be answered, and her time, I'll allow you to respond on my time if you need to respond to a concern.
Thank you, Mr. Chair. In response to the Senator's question, the department, along with the task force, will conduct parent meetings beginning next school year. We will conduct presentations for parents that speaks to illegal substance use to include edibles.
Are these programs currently developed already in preparation for the next couple months, because next year is rolling around soon, or are we planning to prepare them? What is the planning process right now?
The planning process is going on at this time, ma'am.
Okay. I would like to know specifically, when we spoke earlier about the search and trying to get a handle on understanding how these drugs are getting in and what could potentially happen to stop them. What happens when children are caught with these drugs? What happens when you identify that you found maybe one or two are the sellers? What happens to these children? Has anyone been able to catch any of them red-handed?
Yes, we have been able to. I'll have the districts because they deal with it directly. Acting Superintendent at the Herman and Deputy Superintendent Brown, if you could respond, please.
Thank you.
Sure. Good afternoon, Senator. Acting Superintendent Lee Herman, for the St. Croix District. The parents are called in. Students go through a due process hearing at the school level. In terms of their files reviewed, a recommendation is either they're suspended because it is a level 4 infraction, but the suspension is either with or without a recommendation expulsion based upon the child's past history and the incident. In I think about one or two, I think in all of the cases, they were able to identify, don't quote me, but at least the majority of the cases, they were able to identify how the child got access to the product. One of the things that we often have issues with is that because sometimes the child or children ingest all of it and dispose of the package, and it comes in a separate packaging, it may come in a Ziploc bag, we're not able to have the police say the level of THC or what was ingested or how it was. So we go based on a description of what the children have ingested. And so that is how the schools are able to verify once the nurse checks them out and see what they're going.
Thank you for that.
Sure.
Was my time called? I couldn't hear.
No, Senator, not yet.
Okay, thank you. I wanted to ask, in the testimony I was reading, they spoke about substance abuse, and after the third occurrence, the student would get some kind of level of support after the third one. Why is it not after the first occurrence where you try to tackle the issue right away as opposed to waiting for a third time before you attempt to give them some type of assistance?
So, Senator, to clarify, where you're seeing 3 and 4 in there, it refers to the level of infraction. So, according to the board policy, a level 3 and a level 4 infraction is where possession or use of illegal substances fall under. We do, regardless of whatever time it is, we do issue counseling mandates and referrals for the students. So AC SOM has worked with the districts in identifying partners that we can refer individuals to. We are working on the upcoming school year, creating MOUs with partners so that we would be able to not suspend home, but try to suspend them to the partner agency for services.
Time.
Part of the policy-making process, do you guys intend on making, like, say, classes that are incorporated into the school, such as drug classes, prevention classes, conflict resolution classes, things that could teach the students and assist them with potentially even a prevention form, as well as even how to handle a situation if they're approached in school? Is that part of the planning to create classes like that they could take?
We're implementing some social emotional initiatives in the upcoming school year. We've identified time to do so. We have workshops through HITA. We're going to continue to partner with the Department of Health as well as VIPD in putting on workshops and informational sessions for our students. So I would say yes, not so much a class where they're getting a grade, but informational sessions where we're going to engage them in a discussion.
Okay. Well, thank you, Mr. Chair, for the time. I just want to close in saying that we spend a lot of time saying the children are our future, but if this is the future that they're seeing, we're going to have a major problem. And I think it's very important that these things are not just talked about, but they actually come to fruition and they're implemented. So I appreciate the additional time, and any other statements Mr. Stone would like to share, I'm sure he could do it on your time. Thank you, Mr. Chair.
Thank you very much, Senator Francis Heyliger. Mr. Soames, you had some additional information that you wanted to share with the good senator at this point?
Thank you, Mr. Chairman. Victor Sum III, Assistant Commissioner of Education. Having spent the last 20-something years in education, one of the things I know about Virginians children is that they are resilient. We may be facing hard times, but our children are absolutely resilient. And I want to clarify for the senator's benefit that when I spoke about IEPs and the discussion on substance abuse, if an IEP student is suspected of substance abuse, then certainly as a part of the conversation, certainly as a part of the IEP meeting, that discussion will happen. The senator may not have sat on any, but I sat on a lot because I came from alternative education, where students who were substance abusers, that discussion was had, counseling was provided, guidance was provided, not only for the student, but for the parent as well. And so again, it was for those IEP students who identified, who were suspected as being substance users. Thank you, Senator.
Very well. Thank you. Thank you.
I just wanted to say that I do appreciate this hearing so we could be educated and learn a little bit more. And as legislators, we know what our part is to do. And, you know, as Mr. Som say, our children are resilient. And I don't have a problem with them being resilient and dealing with difficult conditions and quickly recovering after a hurricane. But to get an education, that should never be a part of the discussion. Thank you so much, Mr. Chair.
Thank you very much.